I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community.
Not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID.
All right, hello and welcome everyone to the Friday Public Health Media Day update. My name is Cameron Brown, and for today's schedule, we have Dr. Coren with us, as always. We'll get all the latest public health updates from him about COVID, Mpox, vaccines. We also have a special guest, Melissa Hernandez from the Environmental Health Department, and we're going to be learning a little bit about water wells, well safety. So again, a busy schedule, so we'll jump right in. Dr. Coren, hand things over to you.
Thank you. So we've seen good progress in our infectious disease response so far, and we're definitely in a better position to address potential upcoming events. Nevertheless, there are also some challenges in the future, especially the slow uptake of vaccines in children and of bivalent vaccines in the adults, which is these bivalent vaccines are highly effective and the best vaccine to combat the new COVID variants. So first we'll cover Mpox, then influenza, and then what's new in the COVID pandemic. Starting with Mpox, as of October 11th, globally, there were over 71,000 cases, 26 deaths. In the United States, 25,600 cases, and we have had 2 deaths here. In California, it is predominantly seen in LA, San Diego, and San Francisco with the highest numbers. There have been no deaths in California at this point. The numbers are declining steadily, and this is confirmed by wastewater surveys. In Mendocino County, as of October 21st, 7 cases have been confirmed. Several dozen high-risk cases were vaccinated here. On October 7th, more of the Jynneos vaccine became available, and so the eligibility increased to those who need pre-exposure prevention or prophylaxis, and that would include people in the healthcare field, in the labs, who frequently deal with Mpox. The other thing is that secondary vaccine doses are now beginning, and we have plenty to go forward with that. The Mpox vaccine is available through your health providers and through the Department of Public Health clinics. We recommend calling the call center before coming in for this, and the call center number is 472-2759. The biggest barrier is the stigma and the lack of trust, making contact investigation and contact tracing very difficult in our county, in spite of excellent procedures to protect people's identity. So if there are people who feel that they should get preventive vaccine before they have been exposed to a high-risk situation, please give us a call or your provider a call, and we'll get you a vaccination. Moving on to influenza. Influenza started early this year after a late peak in California in the spring of 2022, so just a few months ago. This year, there have been no new cases in acute care general hospitals, long-term care facilities, or skilled nursing facilities yet. We're advising everybody to vaccinate with the flu who's over 6 months of age, and they can do that at the same time as they get their COVID shots. Measles is another of these infectious diseases that we're following, and it's important to note that in Zimbabwe, they had an outbreak with 6,500 cases and 700 children died as of September 6th of this year. So remember, children should be getting their childhood vaccines, which does include measles vaccines. Moving on to COVID. As of October 20th, statewide, we're continuing to see a decline in COVID cases and for the most part, hospitalizations. The test positivity is down to 4 to 5%, but testing is still at a low level. However, this is confirmed by the wastewater studies in California. In Mendocino County, cases and hospitalizations and test positivity have also fallen. The cases are now in the range of 4 to 5 per 100,000 per day, which is comparable to the lowest rates we've seen last spring and also in the spring of 2021. Testing has decreased, and mostly it's done at home. But wastewater surveillance, the new technology, is being used more, and it's being used for COVID, but also will come online for respiratory syncytial virus, Mpox, and others probably soon. In Northern California, we only have wastewater surveillance going on in one site in Humboldt County and 2 sites in Lake County, though Ukiah will soon be added to this group. Lake County, in one of their 2 sites, did show a small possible increase, but the other samples from the other counties were insufficient to be included in that. Transmission and community levels are now low, comparing to the old blueprint levels, which you can see on the colored lines on this chart. We have been in the orange or 3rd tier. It's on the borderline again with red, but hopefully in the next week or so, it will decrease again. In the hospital, we have 2 today in there because of COVID. The deaths have increased slowly in California in certain areas recently, but they've generally been stable. And in Mendocino County, we are still at a total of 136 people who've passed away because of the pandemic. The greatest burden is still highest among Native Americans and Hispanic communities due to social factors, poverty, insufficient housing, transportation, and access to health care. We have one outbreak in the county. It's very small. We did have a small school outbreak that also ended last week. As far as vaccines go, our Mendocino County statistics show still only 68% are fully vaccinated and 58% are boosted, which is on a par with the state. But in the age groups of 5 to 11 years old, only 26% of our children have been vaccinated, and that compares poorly to the California rate of 40%. And in the 6-month to 5-year age range, only 1% have taken advantage of their vaccinations. Native American and Hispanic populations are significantly less vaccinated than whites. In the Hispanic population, the disparity seems now to be primarily due to poor uptake for the children. And we think this is due to fewer after work hours access. So we're adding some Saturday clinics. I'll get more to that later. Bivalent boosters are now proven to be the most effective and safe, especially with added protection against the BA.5 new variants. The older vaccines did not include that variant in what they immunized us against. Yet the uptake of this new bivalent vaccine is only 10% of the initial vaccine rollout of boosters nationwide. The bivalent boosters for 5 to 11-year-olds have recently been approved, and the FDA is now considering COVID primary vaccine series for babies under 6 months of age. Novavax has been approved as a booster for those who had the Novavax primary and those who prefer the Novavax for medical or other reasons. The new Health and Human Services report shows research that boosters have saved 650,000 hospitalizations and 300,000 deaths of seniors on Medicare. Note that people question the need for vaccines in children. Children can get very sick and die from COVID, but less often. However, they can and do carry the virus back to family members who may be more susceptible to complications. Also, the bivalent vaccines have been shown to give some protection against long COVID. So prepare for the upcoming holidays and festivities. Get vaccinated now. The feds are also talking now about commercialization of all these vaccines, moving from free to paid vaccine. And Pfizer has just reported in the last couple of days that they're planning to raise the price, the cost, to 3 times what it has been. Another reason to get vaccinated now. Here in Mendocino County, we have all the rural and federally qualified health centers and most of the pharmacies offering the new bivalent vaccines. Check out MyTurn and vaccine.gov or call our call center line, 472-2759. And it may take a week or so to get an appointment, but as of today, appointments were available in all areas of our county at the pharmacies, at our public health clinics. People are also encouraged to drop in. They can make an appointment, but if they've forgotten to make an appointment, when we have the clinic, you can drop in. Department of Public Health regularly has vaccine clinics at the fairground and at the Department of Public Health Services every week. Next Saturday on October 29th from 9 a.m. to 2 p.m., we're planning to have a clinic for both COVID boosters and flu vaccines. Make an appointment or again, drop in. We're also putting on special pop-up clinics at or near schools or with tribes and other community organizations and residential care facilities as we are invited. Find a place on My Turn and now also look at vaccines.gov. If you can't get to that on our website, call our call center again, 707-472-2759. Get the COVID and the flu shot vaccines together. Moving on to therapeutics, treatments for people who have gotten COVID. In addition to the vaccines to prevent, we now have very effective treatments available for people who have mild COVID symptoms. These are oral 5-day treatments, much like an antibiotic you'd get for sore throat. They're best if started within 5 days of diagnosis, and treated people over 65 years old are 1/5 as likely to get hospitalized than those who are untreated. These are in plentiful supply, but they have been underutilized. It's most effective in those people who are over 50, low income, racial and ethnic minorities, and especially the people who are not vaccinated. Unfortunately, people don't think of themselves as elderly or high risk if they feel healthy. But treatment can reduce the time and severity of symptoms significantly if started on time in less than 5 days for the orals. If it's a couple of days later, then some of the injectables can still be used. So remember, this is like an antibiotic. If you're sick, consult with your doctor and request this treatment. It'll also decrease the risk of long COVID. So if sick, test, and if positive, request the treatment. If trouble getting into a clinic for an appointment in time to start a medication, use the new free state contracted telemedicine service for prescriptions. And that is Sesame Care, SESAMECARE, which is at a telephone number 833-686-5057 or www.sesamecare.com/COVIDCA. I want to go on to some updates that have come from the California Department of Public Health. Last month, they changed their recommendations that testing in most facilities and for first responders is no longer recommended on a routine basis. Of course, if people do have symptoms, they should be tested. But these routine tests that we were doing on unvaccinated people is no longer felt to be useful. Also, there were questions for clarification of close contact. So the recent CDC and CDPH have put out a clarification. There is still the same concern about face-to-face contact. If you're less than 6 foot away from someone who has COVID and you're there for 15 minutes over a 24-hour period. And the definition of close contact also includes, because of airborne, shared airspaces for 15 minutes over 24 hours. The question was, well, what's a shared airspace? And what the clarification has been is less than 400,000 cubic feet in that space is a shared airspace. So if it's much larger than that, then it's like being outside. But just to give you an idea, 400,000 cubic feet is in a large building that has 10-foot ceilings and is 200 by 200 feet area. So going into a small store or even a shopping market can be a shared airspace. And you're not in a shared airspace if there are floor to ceiling barriers that completely enclose what's another room. So be concerned about that. And if you are concerned, if you're at higher risk than wearing a mask in that kind of a space, since there may be people who have COVID, even without symptoms, could be there and transmit in that kind of a situation. So what are the future projections? COVID cases and admissions are decreasing now. They're usually variants BA5 and BA4 that have come down now to 90% of the genome sequences, and they're decreasing. New variants last month we talked about were BA2.75 and BA4.6, which are now up to about 5% of those sequence samples. And they had a little bit of a growth advantage with slight resistance to the therapeutics, but they are not advancing very rapidly. Currently, there are new, more troublesome variants, and they're by the name of BQ1 and BQ1.1, which are also descendants of the BA5 variant, and these spread more rapidly. These are also the most immune evasive so far, but being of BA5 family, they are susceptible to the new vaccines. It's important to note that Europe and Australia are currently seeing exponential growth in cases and hospitalizations. In the USA, with the lower vaccine uptake and the appearance of these two new variants, the forecast is for a possible rise in mid-November. So in summary, we've had a good month and probably will be able to continue that for a few more weeks, but there are challenges and the possibility of a surge from a new variant. We've missed 2 years of holidays and parties due to COVID. Now we have great new tools that we didn't have last year to keep us strong this holiday season. So let's take advantage of them and enjoy our family and friends. Get boosted or vaccinated if you're not vaccinated. Especially don't wait to get the new bivalent vaccines. The only booster vaccines, the only bivalent are the boosters at this point, though they are looking into making bivalent vaccines. But if you're vaccinated, get boosted and get boosted with the bivalent vaccine. If you're sick, stay home, get tested either at the home or clinic. And if you're positive, call your provider and request a treatment. So, because it may be difficult to get in the required amount of time. And if you can't get in, try using the telemedicine line and start that within 5 days. And also, if you're sick, remember to mask if you go outdoor anywhere or to indoor public spaces if you're feeling sick at all. And I'll close at that and be open for any questions.
All right, so we just heard from Mendocino County Health Officer, Dr. Andy Coren. And before we jump into any public questions, we have another presentation from our special guest, Melissa Hernandez from Environmental Health. So Melissa, if you want to jump in, it is all yours.
Sure. So like you said, my name is Melissa Hernandez. I am from Environmental Health. So I just popped on my visuals so you guys can just see me for a quick second. And now I'm going to switch to that PowerPoint. Share my screen here. All right. So environmental health, we're a division within public health, and our main topic today will be water wells and how they relate to environmental health. I am an environmental health specialist within environmental health, so let's kind of break down what is environmental health first. So I am an inspector in consumer protection, and we deal with body art facilities. So that is your tattoo parlors, your permanent makeup, your food facilities. So those are your restaurants, Safeways. Then we have public swimming pools. So those are going to be your pools in hotels, recreational centers, and we have state small water systems as well. In consumer protection, we'll break down what those are in a bit. We also have hazardous materials, and there we have the folks that work in CUPA, so that's Certified Unified Program Agencies, and these individuals deal with your auto body shops. And LEA is Local Enforcement Agency, and this individual focuses on transfer stations and solid waste. And REHID stands for Redwood Empire Hazardous Material Incident Team. So this team would go out if there is an incident on the highway, let's say a gasoline tanker flips, and they're going to respond to help mitigate that hazard on the roadway. Then we have lastly, land use is the last unit in our division. And they handle mussel sampling and ocean beach monitoring. They also permit septic pumpers and septic systems. And I did leave water wells at the end because that'll bring us to our main topic for the day. So water wells in land use. So our land use inspectors receive applications for new water wells that want to get drilled. So during that review process, we focus on making sure the water well is meeting the required setback, and those setbacks, so an example would be a 100-foot setback from leach fields, 100 feet from animal or fowl enclosures. So making sure any potential sources of contamination are far enough away from the water well that won't make a hazard to it. So after we review the application, we issue the permit, and the well driller will get back to us once they're ready to seal the well, and we go out and witness that seal. And you might be saying, what does that mean? So when we go out and seal, we go out and observe this space, which we refer to the annular space, and we want to make sure this gets sealed correctly. So people will use neat cement, bentonite chip, and that creates a barrier so that contaminants don't have an easy way to an easy access to that groundwater. So just making sure that seal is nice and tight, and just making sure we're reducing the contaminants that potentially get to your water supply. So what are some types of water wells? So most folks in corporate areas won't really think about water wells because they're on a community water system, a water district, and those wells are going to have a 50-foot seal. Industrial wells also have a 50-foot seal, and those are going to be your commercial sites. Environmental health, when I did do land use for a quick second for 8 months, and I most commonly saw water well applications come in for agricultural wells and domestic wells, and those are farms, and domestic is in a house, a single house, or 1 or 2 houses, and those get 50-foot seals. So this is another little, our water well application blown up. So this is what we're looking at. So the water well driller tells us what they're using and how they're going to be drilling that well. So like I said, most people in corporate areas are going to be on public water systems, and most of the times they're not dealing directly with your water source. There's another group of folks, the state small water systems. These individuals have more connections than would not be regulated. And we have about 27 in Mendocino County, and they're expected annually. And this would be a good group to just kind of, if you are on a domestic well, you can use this as how you should be handling your well. So for these groups that service more than, it's between 5 to 14 connections, we take a water sample annually from them, and we're checking for bacteriological, and that will be your total coliforms and E. coli. We take it and we get it tested, making sure that is not present in the water, and they are supposed to test it quarterly themselves. So if you're on a water well, it doesn't hurt to test it quarterly as well, making sure you keep record of those samples. making sure if it does come back present for something, you mitigate it and find the source of that potential contamination, reaching out to someone who's a professional who can help you rectify the problem. So like I said, we go out to these state small water systems and we inspect the tanks for leaks as well, just kind of help them their general maintenance and look for their record keeping. Many of our systems will be on disinfectant treatments, and that'll be a chlorinator, an ozonator, an ultraviolet light. So for a chlorinator, you can test it daily and see if you find any residual. And we're looking for 0.2 to 0.4 parts per million in chlorine to make sure that treatment system is actually working properly. You can test ozonators for a little bit of residual, but it dissipates very quickly, so it's a lot harder to test residual for that type of system. And same goes for ultraviolet light. For this system, you just have to make sure that the ultraviolet light, that light bulb is functioning, so checking on your pump houses and making sure your units are actually on, they're actually working. So record keeping and having someone who's regularly going out and checking your systems. Okay, and so just so like a little breakdown, what would put you in a water system or what doesn't put you in a water system. So anybody that is 15 or more connections, that's a public water system. That's going to be regulated by the state, the water board. And if you have less than four or less, that would be, you don't get regulated by either the county or the state. So our state small water systems are a small set of folks that are between 5 to 14 connections. So Mendocino County is no stranger to disasters, unfortunately. So if you are on a water well, always making sure you're monitoring it. So if the water goes out or the light goes out, having a backup source. So making sure you have a good storage solution. So making sure your storage tanks don't have leaks. And if your pump runs out or your chlorinator runs out, having a method to disinfect it and make sure the water that you're drinking is safe. So boiling it, you can do some disinfectant or filtering it. I would recommend having something like this printed out with your, wherever you store your emergency equipment in case of an emergency. Because if your internet's down, this is not going to do you much good. So having a printed source, that way you have something to look back on and make sure you have safe water and you know the steps to get to safe water. That brings us to our last slide for the day. So these are just some useful links. I'm going to focus more on that center one where it's, if you have any questions for environmental health, that's our information. Our telephone number is 707-234-6625. So that's our Ukiah office that is located in the administration building. And then in Fort Bragg, our telephone is 707-961-2714. And there's also information on the sides for the water board, as well as Alpha Analytical if you do want to test your water. And then some links on the side. So if anyone wants to screenshot it, feel free. But that does conclude mine section. So I'll turn it back over to Cameron.
All right, thank you, Melissa. And again, that was Melissa Hernandez, environmental health specialist. So we do have a few questions from the public. So let me pull those up. First one for Dr. Coren. For sexually active people, should they get the monkeypox vaccine just in case?
So sexually active people can. It is mostly for those people who are at risk, and we see that the predominant group who have gotten this has been men who have sex with men, but it has also been men who and women who are providing services for sex, and that can be a number of people, either men or women, or people who are having frequent sex in venues that are open for sex. So it's not your usually sexually transmitted disease. Um, so it's for a group of people who really are at higher risk because of their behaviors where they are, or if they are in contact with someone who may be at high risk, they may elect to get the vaccine as well.
All right, thank you, Dr. Coren. It looks like we have another one here for you. Asking about the Moderna vaccine. This person said that was the vaccine that they liked and that they wanted. They're having trouble finding it now. So why can't I find the Moderna vaccine now?
It's a great question. Thank you for asking it. The Moderna company has produced a lot less vaccine, and there may be some problems with their factories. I don't know, but the expectation is that they're not going to produce nearly as much as Pfizer. And that's for both their vaccine and their bivalent vaccine. So it's very hard to find the Moderna vaccine. We did get some in, and we have had them available. I think we may have just run out today, or we shortly will. Know that the Pfizer vaccine is every bit as good. They're really very equivalent vaccines, and I always think back to flu vaccines. You go in, you get your flu vaccine. Most facilities do not give you a choice if they're equivalent vaccines. And I think that the way to think about this is we have BA.5 variant of the COVID germ, and we want to get a vaccine, and at this point a booster that is specifically targeting the BA.5 and the others in that family. And so it could be either the Moderna or the Pfizer. And there really is no reason from a medical or scientific point of view to get one or the other. But the availability of Moderna vaccine is much, much less, and that's all over the country.
Great, thank you. And it looks like we do have one question for Melissa. This person had just acquired some property in Anderson Valley, and see, how do I know if the well is safe because they don't have records from the seller?
So, I mean, one thing they could do is test the water. There's two types of tests, bacteriological and mineral. The basic one we do is bacteriological, so that's testing for your fecal matter. So that would be a start from them, just taking a water sample.
Okay, great, thank you. And let's see, another question for Dr. Coren, asking about the new booster. This person had heard the new booster is more painful. So is that true? And is the reaction really worse?
No, there's no data that shows that it has any more side effects, and that would include pain. All of these boosters are a little bit more what they call reactogenic. That it means that in the tissue that they inject it in, you can get some more inflammation. But that's not all the time. It's a minority of the time. But of course, those of us who feel it complain about it a lot, and it gets a reputation. But I think that they're very much in line with other vaccines that we've gotten for the flu and others. I had both of them on the same day, and I couldn't tell the difference which arm hurt more or less. And I really had a little ache for about a day, and that was about it.
Great, thank you. And looks like one more question for Dr. Coren. This person is in their early 50s, wondering if they should get a COVID treatment if they're sick, or just build up the natural immunity by letting the virus kind of run its course.
Excellent question. Excellent question. Well, if you're symptomatic, you are certainly eligible to get the treatment, which is at this point the easiest one to get, is Paxlovid, which is an oral tablet that you take for 5 days. And if you're symptomatic and you're over 50, that treatment really does help quite a bit. It's noticeable. It's very significant. May not be noticeable to an individual person, but you don't want to wait until day 5 or 6 or 7 and you're feeling really horrible. So now, if you're over 50 and you have symptomatic COVID, you should, and what I'm recommending is that people call and request the treatment. And if you can't get in to your clinic or your provider, then I've given you the information on how to call the state-sponsored telemedicine service. In any other situation, it would be a paid service, but the state has seen that our uptake of Paxlovid is not what we want it to be to prevent hospitalizations and deaths. And so they're making it easier for people to get it on their own. So it's you test yourself. You have to be positive, and then you attest. You tell the person, the provider on the line, what your symptoms are and possibly what medications you are that may interact, and they will help you decide whether it's worthwhile, and then actually prescribe it to a pharmacy near you.
Thanks, Dr. Coren. And it looks like we do have one more question for Melissa with environmental health. And let's see. So this person's well, the last couple of years has run almost completely dry. So they're wondering that if the water does sort of come back, is it more likely to be polluted or dirty?
So whenever that happens, it doesn't hurt to retest the water when it does come back, just to be sure it's not contaminated. And just to expand on how you would do that, locally we do have Alpha Analyticals here in Ukiah. Both of our offices, Fort Bragg and Ukiah, we have bottles that you could take with you to sample at home. And so when it does run dry, increasing your storage capacity, that way when it does happen, you have that backup. So it's unfortunately not completely uncommon to run dry at the moment. It's still kind of rare. Most people aren't running dry, but I have had other instances where they stay small, routinely running dry at a certain point in the year, almost to the T, and usually in June. And they're prepared. They have a backup of getting water purchased. So when it does come back, I would recommend just testing it, making sure it's still safe. And if you do want to reach out to us, our number is 707-234-6625. That's our main Ukiah line. If you did want to have some samples, we can give you some water bottles, some bottles to sample water.
Okay, perfect, because that actually helps to answer this other question asking if they can bring water samples to public health.
So not to the Ukiah office. So we're very close to on Mason Street. So if you have your water sample, take that directly to the Alpha Analytical. But if you're on the coast, we do offer the service of a courier stops there, I believe 11 in the morning. You can always call our Fort Bragg office to know specifically what time to place that. There's a cooler located outside our building where a courier picks up every day for the coast. And I'll go back to my slide just because that number I don't have memorized. So the Fort Bragg office is 707-961-2714. So don't bring your water samples to the Ukiah Environmental Health, but you can do it for the Fort Bragg office on 120 West 1st Street.
Great. Okay, thank you for clarifying that. And then we have one more question for Dr. Coren. We'll keep taking them as long as they come in. So this person is asking, they help operate a care home on the coast for disabled persons, and they're wondering if public health can provide rapid tests.
Yes, we can. We have plenty of rapid tests, and we can, if you request it, call our call center at 707-472-2759 and request some tests. and we'll see that they get out there, probably from our Fort Bragg office. But also, we're looking to be sure that all these care homes are getting their clients vaccinated, because now's the time to do it. And those care homes have probably some of the most vulnerable people in the county. We want to make sure that they're well protected. And again, the bivalent vaccine is very helpful against the BA5 type and all of its subtypes, whereas the old original booster did not include the immunogenicity of the new ones. So make sure your people are vaccinated. If they're not, then leave that as a message also when you call the call center.
Great, thanks, Dr. Coren. And it looks like we may be done with our public questions today, so we might end a little early. Yep, I think we are done. So we heard from Public Health Officer Dr. Andy Coren, got all the public health updates for flu, COVID, and Mpox. We also heard from Melissa Hernandez with environmental health. So thank you to everyone that listened in and asked questions. We'll keep going with our third Friday of the month, Media Day. So that means the next one is November 18th, Friday at 2 p.m. So in the meantime, if you want updates, you can look at our website, mendocinocounty.org/ph. Also, the public health Facebook page is updated pretty frequently. So until next time, have a great weekend, and thanks again.
Melissa, thank you. It was a great